Welcome to Pregnancy, Week by Week with Andrea. I'm Andrea Faulkner-Williams, owner and co-founder of Tubby Todd Bath Company. This year we are expecting our fourth baby. I know, our fourth. We can't wait to add another Tubby baby to our home. In the meantime, I'm working on being pregnant. I'm feeling the ups and downs and highs and lows that come with it all. I want to share with you the tips and tricks I've learned throughout my 4 pregnancy journeys. I hope you not only find them helpful, but more than anything, you remember that you've got this, mama. I'm so excited to be on this baby growing journey with you. Hello and welcome to Pregnancy Week by Week with Andrea. I am Andrea Faulkner-Williams, co-founder of Tubby Todd Bath Co. and head mama here, and I am so excited to be sharing these week by week tips with you about pregnancy. This is my 4th pregnancy and oh man, it's a journey. So I'm excited to be on it with you. And today I want to talk about taking control of your medical care. So I have delivered both with a midwife and an OB. You might be delivering with a midwife at home, in the hospital, in a birthing center. I think that this advice goes to anyone who is pregnant. And let me tell you why I want to talk about medical care. A lot of times when you're pregnant, especially in your first pregnancy, and even for me now in my 4th, when I go to the doctor, I go in with a lot of anxiety. I want to hear the heartbeat. I want to make sure everything's okay. And those kind of checkup points, I'm really looking for my medical professional to reassure me that everything's okay. Not all doctors, OBs, midwives are created equal. And I think that you probably know that by now. And I have noticed that sometimes they say things and maybe it's just a comment or a checklist that they're trying to go through with me to make sure that I'm having a healthy, safe pregnancy, but it can really derail me. And so I want you to look at your OB and look at your midwife as a voice of reason, 100%. Always run everything past them, but don't look at them as the voice of God, which is sometimes a fault that I've had, where I'll go in and they'll give me feedback about something in my pregnancy, and I will take it so hard and really allow it to affect me. So let me tell you an example of this. In all 4 of my pregnancies, my medical professional, so my OB or my midwife, the medical professional has told me that I need to be careful of weight gain, that I was gaining weight too fast. Now, this has never been my favorite thing to hear, nor do I think anyone, female or male, pregnant or not pregnant, loves hearing that you're gaining too much weight, especially when you're pregnant and you're trying to be healthy and exercise, which I've tried to do in all of my pregnancies, and take care of myself and eat the right and blah, 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 blah. But I've gained, more than the recommended weight gain with all of my pregnancies. And when they've said this to me, some of them have said it in more of a conversational way. Like, how are you feeling about your weight gain? Do you feel like you're eating healthy? Are you exercising? What are you doing? What do you feel like you need to do in order to take care of your body? Also, they've asked me questions like, how much weight did you gain in your previous pregnancies? How big were your previous babies? Now, not all of them have done that. Some of them have just come in and said, hey, you need to not gain so much weight, and then moved on to something else. And that will really throw me. It's happened 4 times, and 3 out of the 4 times, I feel like it's been said so directly without any conversation that it really has thrown me. One of the times I had a doctor who really sat down and spoke with me about it and, had a conversation, and it really inspired me. So although it was not my intention to be thrown those other 3 times, it was what I chose to believe. I chose to believe they think I'm fat, they think I'm doing a bad job, and I kind of spiraled, or there's no other options other than, them just telling me not to gain weight. When what I could have done is I could have had a conversation with them. I know that a lot of people have probably had this experience with type of deliveries. If you're trying to decide what type of delivery you're gonna have, if you're having twins or wanna have a VBAC, or a specific consideration about, what type of delivery you're gonna have, epidural, no epidural. So I wanted to give you some tips. I've thought a lot about this for how I have been able to have the best possible relationship with medical professionals during my time being pregnant and postpartum so that I can take the emotions out of it and I can actually have conversations. So the first step is to stop and take the emotions out of it. And for me, at the appointments that I go to, I have to come prepared, knowing if I want to talk about something and knowing what I'm going to say. Because honestly, I get to those appointments and I'm so nervous about the heartbeat every single appointment. And just knowing, is everything okay? And just having them measure my belly and make sure everything's growing the right ways. And so I have to come prepared with it written down, or maybe I bring my spouse or my partner with me or my mom to make sure that I can really express the concern that I have, whether it's weight gain or a delivery. And I will plan that out ahead of time. So if they present something to you during an appointment that you're upset about, maybe wait to call them later so that you can think through the emotions and plan out what you're going to say and what conversation you want to have emotionless, in a really good level-headed position, or as level-headed as we can get when we're pregnant. The second thing that I would recommend is having a conversation. So not just saying to them, hey, I want to have a VBAC, and they come back to you and say, no, you can't have a VBAC, and we move on. Ask some questions, have questions prepared. Talk to them about, well, why do you think that is? Have you had experiences with other people? Because they are medical professionals, they have seen a lot of other patients, and there's probably reasoning behind that. And again, it is not the voice of God just telling you what to do. You need to have a conversation with them. So that's my second step. And my third step is, if you're not satisfied after you've come prepared, really in a good spot, and you've had these questions that you've given them and they've answered, and you've had a conversation, go get a second opinion. And I'm not talking about going to the internet. You need to go to another healthcare professional, another OB, another midwife, and ask them for their opinion. A lot of times in practices, I know the ones I've gone to, there's always been another doctor that I've been able to see. So maybe you could go make an appointment for your next checkup with someone else who works in their practice. And you don't have to worry about offending them. This is your body. This is your baby. You get to take control of it. And if it's something that you're still chewing on, you have mother's intuition, and you can go and ask someone else what they think about it. They might come back to you with the exact same response. And then that will help really take away any fears that you weren't making the right decision with this first medical professional. And now you can feel comfortable moving forward. Or maybe they'll have a conflicting advice and you'll want to get a third opinion. Do your best to go after people's opinions, and don't just take what they say at face value and allow it to take you down an emotional spiral. I've had so many friends who've taken medicine when they were pregnant and have had people tell them, for a mood disorder, oh, that's going to hurt the baby. Well, really, that wasn't true. That person wasn't educated on that type of medicine. They weren't up with the most recent studies on it, or they didn't give them the right type of direction for what they needed to do to be prepared for a specific type of delivery. It's our responsibility as mothers and caretakers to these little ones to really fight for them even before they come out of our bodies, and fight for yourself, fight for your body. And so I want to give a huge love and thank you out to everyone who is a labor and delivery nurse, a midwife, a doula, an OB. I love you. I respect everything you do. And I am in no way thinking that I know better than you. I'm thankful for the people who have helped me get my 3 babies here safely. I could not have done it without you. And I am very grateful for the times when I've been able to have honest, frank conversations for them. And I hope that you will be able to have that same experience with your caretakers over the next few months. Thank you for tuning in today to Pregnancy, that's another one, with Andrea, Week by Week with Andrea. I am so happy you're here. I hope you're having the best week. I hope you're doing things for you and that you're feeling okay. And if you're not, it's going to get better. Okay, have a great week.